Hi, beautiful people. How are ya? I hope you're having a great day. Experiencing chest pain can be scary. You might think that you're having a heart attack or heart problem, lung issues, pneumonia. That's scary. But there's a lesser known common condition called costochondritis. It's also called non-cardiac chest pain or musculoskeletal chest pain. About 3 of every 5 fibromyalgia patients may experience this. Swollen, inflamed cartilage, called the costochondral joint, that connects the ribs to your breastbone, the sternum, can cause sharp or aching pain. It can suddenly come on or develop slowly over time and spread across your chest. About 30% of people who go to the emergency room with chest pain are diagnosed with costochondritis. It isn't life-threatening, and treatments are available. People with rheumatoid arthritis, RA, ankylosing spondylitis, and osteoarthritis are conditions that often occur prior to costochondritis, but it's also diagnosed in people with fibromyalgia. So that's what I'd like to talk about today. Here we go. In fibromyalgia, people will experience chronic pain, stiffness, and tenderness all over the body. We've learned over the last year that there is neuroinflammation and systemic inflammation found in fibromyalgia patients. Studies have found inflammation in cerebrospinal fluid and plasma in fibro patients. High levels of fractalkine, also known as chemokine CX3CL1, has been found in fibrospinal fluid. Chemokines can be protective or destructive. Interleukin 6 and 8, also called IL-6 and IL-8, have also been found in blood cells. Unfortunately, these are not detected in routine blood tests. The importance of this is that fibro-related inflammation can affect cartilage and other areas of the body. Inflammation, pain, stiffness, and muscle spasms can occur anywhere in the chest, and the result is costochondritis. Researchers strongly accept that there's an association between costochondritis and fibromyalgia. Some people with this pain are how their fibro started. It may start with an attack that feels like a heart attack, end up in the emergency room, and for months, a person will begin experiencing pain all over until a fibromyalgia diagnosis is reached. It's not known what causes costochondritis, but it could be from a car accident, recurring trauma, or overdoing the chest muscles and cartilage, or from a viral infection like an upper respiratory infection, or your fibromyalgia caused it, and that is where it started. For example, my fibro started in my feet and then my hips with plantar fasciitis and hip bursitis. Both are inflammatory conditions. And then I felt it all over, such extreme muscle and tendon pain and fatigue, but not in my chest area. I'm one of the few who was spared pain in that area. I have tenderness, but not pain. My pain is everywhere else: my feet, legs, hips, arms, hands, neck, and back. My head and face are tender but not painful, but we're all different. And for a diagnosis of fibromyalgia, you need pain on your lower section, upper section, left side, and right side, among a few other things. Don't overlook your costochondritis symptoms. Seek medical attention just in case that there is something happening with your heart. Myofascial pain is pain in the fascia lining the muscles. It could be this myofascial pain triggering costochondritis in the chest or rib area. In addition, if you've had a prolonged cough from COVID, for example, it can put pressure on the cartilage that joins the ribs to the sternum and damage it and cause chest pains. The good news is that symptoms can ease within days with treatment, but if it isn't better within a week or two, fibromyalgia is likely the cause. The pain of costochondritis can be stabbing, burning, or aching. The pain can be confined to one area, usually in the center of the chest, or it can radiate outward. Depending on the amount of inflammation, patients will experience pain that comes and goes, worsens with movement, deep breathing, or pressure, and will likely worsen with stretching, twisting, or bending. Pain can improve with shallow, steady breathing and rest. Medications are the same as the meds for fibromyalgia: Lyrica and gabapentin, Cymbalta or Savella. Some patients may prefer a heating pad, while others prefer an ice pack. And you can alternate between heat and cold. And for some, a Aleve or an ibuprofen-based medication helps with inflammation. Gentle stretching, shallow breaths in a quiet place, resting and relaxing are important. Getting enough sleep is always needed, as well as hydrating. Eating a healthy, balanced diet, avoiding foods and drinks that cause inflammation, and avoiding allergens, especially food and airborne allergens. Although fibromyalgia patients find exercise intolerance an issue, gentle exercise can be beneficial, like walking or swimming. Some people do yoga or bike ride. Meditation techniques can be helpful. Additionally, some people find relief from physical therapy, acupuncture, a TENS unit, chiropractor, massage, aromatherapy, or cognitive behavioral therapy. But always consult your doctor before adding a new treatment. And Medical News Today says, quote, "Seek immediate care when chest pain occurs in areas that are not tender, or when the pain is accompanied by symptoms not related to fibromyalgia, such as coughing, fever, and heart palpitations," unquote. I hope you learned something. I send you gentle hugs and support. Love you. End up in the emergency room. My head and face are tender but not painful. Sorry. Pain can improve with gentle exercise can be